Hey, today we're going to talk about a patient of mine that I have treated for years that fractured her left ankle. It was so bad that she had to have surgery. They put screws in, a plate in, but she trusted me. And she said, "You know what? I want to come to you for my rehab when I'm ready to do that." I said, "Absolutely, we can take care of that." So she told her orthopedic specialist and the PA that she was coming to see me for her rehabilitation, and they didn't seem to be really enthusiastic about it, but they let her go ahead and basically do whatever she wanted to do. So we started treating her at the end of October 2 years ago. And she's a small business owner. And so I was treating her, and then we got into the holidays and she couldn't make it in. I had about a 6 week gap in care. During that time, she went back for a follow-up visit with her orthopedic specialist and was seen by the PA and got in there. And the PA was really disappointed and said, "Your range of motion is nowhere near where it should be. Your strength is nowhere near where it should be." And the patient tried to tell her that she hasn't been able to get in because, again, small business owner, people were calling in sick and she had to go in and work. They didn't want to hear it. All they knew is that she had decided to see a chiropractor for the rehab and was really pretty condescending and said this: "We let you go see your chiropractor for rehab and we let you do it your way. Now it's time to do it our way," and did little air quotes like that. So they gave her a script for a local physical therapy place. By the way, it's the same one that I talked about in the last episode. So she goes down, and I had no idea this was going on. Okay. I didn't have any idea until I heard her call talking to my office manager at the clinic. And I could tell by the way that Diane was talking to this patient that she was very upset. And she said, "You need to come in and talk to Dr. Arkfeld about what's happened." And I was like, "Oh my gracious, I wonder what happened." Anyway, she came in crying, very upset. And the first thing she wanted to know is, "Will you take me back? Will you take me back as a patient?" And I said, "I never let you go. So I don't really know what you're talking about." And then she tells me the story. So she said she goes into the PT office and she's cash pay, first of all. Okay, so it's not insurance. I need to say that right away. She goes in, and I never thought about this, but she goes, "I'm at my worst right now. I'm trying to rehab my ankle. I'm hurting, and I'm out in the open. And people in this town know me and they see me, and they're coming up going, 'Oh, what happened? Oh, how you doing?'" And they keep interrupting her. And at some point during the rehab session, just the first rehab, it's hurting and she's got tears in her eyes and she's just frustrated, and she's out in the open, just bare, wide open to the world during one of the most vulnerable times. She just wants to rehab in private. So the things that they were doing, she said she was thinking, I did in the first week of care. They wanted to go and redo everything. And they gave her a treatment program of 3 times a week for 6 weeks. And they told her there is a no-show and cancellation fee of $125. And you have to give us 24-hour notice if you can't make it or if you cancel. And she goes, "I can't do that. There's times that I have employees that wake up and kid's sick and they can't make it in. I got to go in." She goes, "I just can't do that." They also wanted, I believe it was about $150 per session. And she goes, "I can't do that." And then it was going to be an hour to an hour and 15 minutes every session. And she goes, "Yeah, I don't know if I can do that." So she was so upset, so frustrated, and really worried because she had a cruise that she was going to be going on in March. So when she came back to see me that day that she was so upset, it was in early January. So the first thing I said to her was, "It's up to you. If you don't want to go back there, you don't have to go back there. This is up to you. It's not up to your orthopedic surgeon. It's not up to the PA. It's up to you. If you want to resume our rehab, we can do that. Absolutely, we can do that." And she goes, "Dr. Ark, I want to stay with you." And so it didn't occur to me about this open concept that physical therapy has been a negative for patients during their most vulnerable time, during the time that they are in pain and they just want to work through it. They don't want anybody to see them crying or grimacing or struggling during these rehab sessions. And then the other thing, the hour and 15 minutes every session. We had her out 30 minutes. So here's what we did. We brought her back in. I have a neurological electrical stimulation therapy that we use that we got her going again on it, and there was a little swelling, so I had to take down the swelling first. And so we did a little rock blading on that, and then we got her going with our neurological therapy and doing range of motion exercises. I did very gentle mobilizations on the ankle as well. And she goes, I have a cruise that my husband and I have been planning on going on for our wedding anniversary, and it's coming up during spring break in March, and I need to be on that cruise. I said, "We'll have you on the cruise. You'll be walking around, you're gonna be fine." And she goes, "Really?" I said, "Yeah." And she goes, "Do you know what that means to me right now? You just telling me that I'm gonna be fine and I'm gonna be walking on my cruise, and I'm gonna be ready to go to the cruise?" Because when they asked the physical therapist, they said, "Oh, I don't think you're gonna be ready for that. That's gonna be, no, you may have to cancel the cruise." With their protocol, yeah, probably so. What I mean by that, most physical therapy offices that have not embraced the neurological rehabilitation techniques that are now available and equipment are using outdated protocols. So I can treat somebody with our rehab protocols every day, 30 minutes. It's going to take 30 minutes. Oh, by the way, then we get them into home therapy as well. So when they're not in the office, they're still doing things at home. And no, it's not stretches. And no, it's not exercises that they get with a piece of paper. It's a real unit, a home-based therapy unit they're going to be doing at home. So with this patient, I saw 3 times a week. I saw her up until the time she went on the cruise. Every visit consisted of the neurological electrical stimulation. We would have her do different things with that attachment. We'd have her do what we call dorsiflexion exercises, where she's taking her foot that way. We would have her stand up and do raise up on her heels. And we would have her eventually get on little Bosu pods for balance and just be moving around a little bit. And then we got her on a Bosu ball and doing exercises. And we did have her ready. She was ready to go on the cruise. She had a wonderful cruise. The last visit before the cruise, she broke down and was crying. And she goes, "I didn't know if I'd get here, but you got me here." And she said, "You know what I love about coming here is that it's a private room where nobody else is in there except for me doing the rehab. You know that I'm a business owner and you made accommodations for when I couldn't make it in and always got me rescheduled. The treatments were no more than 30 minutes. And by the way, they were not $150 a session. And you promised to get me on this cruise where I could be walking around pain-free and doing everything I needed to do. And Dr. Arkfeld, you delivered on that promise." And that's what it's all about, okay? Going in and telling somebody that a no-show fee right away is $150 and telling them, "Oh no, I don't know if you're not going to be able to go on your cruise." I always say that what we say to a patient many times is more important than what we do. And the first thing that I did was tell her, "Yeah, we can have you ready." That was giving hope. For those of you who are out there that are in the same situation, you've been to physical therapy or you're going right now and they're telling you 6 to 8 weeks, 8 to 10 weeks, and they're not giving you any clear-cut hope or path that you're going to get back to doing what you're doing, you got to get in touch with me, okay? Put a comment in and tell me how I can get a hold of you, or you can contact me via email, info@arkfeldchiropractic.com. There'll be a link below. Send me an email so I can get in touch with you. If you can't come see me, there are offices around the country, chiropractic offices and some physical therapy offices that have the neurological training and the equipment that I'm talking about, and they may just be in your area. and you're going to be able to get your life back. So once again, if you like this, comment, and until next time, and we'll talk about defeating pain together again. Take care.